Right, hello everybody. Good afternoon, good morning, good evening, wherever you're joining us from. A really warm welcome to this online webinar today. My name is Patrick Deuce. I am the program lead for homelessness for an organisation based in the UK called World Habitat. And this today is the World Urban Campaign's Urban Thinkers Campus. On behalf of UN Habitat on the global homelessness response to COVID-19. And I'm really delighted to be able to share the platform today with 5 other presenters from all across the globe who are going to be sharing their experience of responding to COVID-19 and protecting the lives of people who are street homeless. So thank you for joining us. We'll be going for about an hour and a half, and I'll run through some logistics in a second. So first of all, I'm sure many of you are used to using Zoom. If you're not, welcome. It's a part of all of our daily working lives at this point. So some really basic logistics just to start off with. This webinar is being recorded, just to let you know that it's already been recorded now. It will be available on the World Urban Campaign's website in the coming weeks. We'll let all of you know when that happens. And subsequent to this webinar, we'll be writing a short report, which will be pulling together some of the key bits of information from the presentations that you've heard today. And that will also be available on the World Urban Campaign website from next week. So I can see that some of you have been chatting already on the chat function, which is wonderful. You are all muted for this webinar, so we have a range of panelists who will be presenting. Please introduce yourselves on the chat function. For those of you that are new to Zoom chats, please make sure you put the option that says all panelists and all attendees, just so that everybody can see what you are saying. Otherwise, the basic function is just the panelists that will come to just the 5 or 6 presenters. But as ever with these kind of webinars, the best conversation happens often in the chat rooms themselves. So please do introduce yourselves, ask some questions, get to know who else is here. This is a space for people to meet and to share contacts and ideas. So please do get involved. If you want to ask a question, we will be running through presentations. We have got quite a lot of presentations to get through, so we will be taking questions at the end of all of the presentations. But if you've got a question in your mind or you want to ask, please do use the chat function, making sure that you put so that everybody can read it. And if you've got a particular question for a particular panelist, please do direct that to one person. And we also have on Zoom, we have the Q&A function as well. So that Q&A function, the question will come directly to the hosts. So we'll be able to see that. I'm joined today also by my co-host, who is Celeste. So she is here in the background. So if you have any questions now, during, or after the webinar, please do drop her an email on celeste.sangster@worldhabitat.org. So just before we start the presentations, I wanted to do just a quick poll, just to kind of find out what proportion, who's in the room and what proportion of organisations are here, and it might be quite helpful for our panellists to understand who is listening. So if you give me 1 second, I will just, Celeste, are you able to launch the poll now? There we go. If everyone, it's just one question, if you could just quickly click what kind of organisation do you work for, it would really be helpful for us to understand what kind of organisation you work for, where you're coming from, whether that's professional or personal, and we'll share it with all of you in a second. A couple more people, fantastic, there we go. So you should be able to see the results there. So we have got quite a broad mixture. That's fantastic. That's what we wanted. The World Urban Campaign webinars have a very broad audience. So we've got some from national government, some from housing and homeless organisations, but the majority are from NGOs and international NGOs, which is what we would expect from a UN Habitat audience. So thank you for indulging us briefly on that. So quickly, the agenda today, we've got an hour and a half. We will be finishing in approximately sort of an hour and 20 minutes. I'll give you a brief introduction myself about World Habitat, and then we will have 5 presentations of 10 minutes. They appear to have subtitles. I'm not sure if we can turn that off. I don't know why they popped up. Yeah, so I'm really delighted to say that we've got 5 presentations here, and I'll introduce each one before it happens. And then we'll have a short time for some roundtable discussion at the end, where we can include some of your questions. And then we will be finishing bang on the 5:30 CET time. So I do apologise if your questions don't get answered or if the presentations run on a little bit, but we will be finishing at that time. So thank you for bearing with us if that's the case. So as we mentioned, as a way of introduction, COVID-19 is a global pandemic, and most acutely and importantly, it's been an urban crisis. 90% of COVID-19 cases are in urban areas, and a quarter of the world population currently lives in slums, in poor quality housing, cramped conditions. So this means that it's a crisis of public health, a crisis of poverty and income, low income, and is something that has put a spotlight on housing across the world like never before. But what about those without a home? What about those experiencing homelessness and destitution that have no place to safely self-isolate? In cities across the world, in the global north and the global south, the impact of living on the street, on people's mental and physical health makes people far more at risk of developing a range of underlying health conditions that make COVID-19 such a deadly virus. Our focus of the Urban Thinkers Campaign webinar today is on showcasing responses from across the globe and providing space to share and learn from agencies at the very forefront of the pandemic. So this is not going to be a top-level policy presentation. What we wanted to do today was to really give the opportunity to those that are managing and working very much on the front line, saving lives. So across the world, we've seen remarkable responses from NGOs, civil society groups, community groups, and public health institutions to protect people who are street homeless. Backed by effective, swift, and well-funded action by municipal and national governments, we've seen remarkable successes in many places. The realisation to the right to adequate housing for all has never been as important as it is right now, where people who are street homeless have been brought in off the streets, lives have been saved, but we must make sure that we don't regress to pre-pandemic conditions. We cannot go back to a time when we accepted the numbers of people that we have street homeless in the past. So I'm delighted to be able to work in close partnership with the Institute of Global Homelessness today. Julia is going to be giving our first presentation once I've done. And today we will hear from practitioners and housing rights advocates from 6 different countries, sharing how they've been working tirelessly to protect the lives of people who are street homeless during this pandemic. I think it's really important to note that the pandemic is not over. And what you will hear today is not the final answer, it's not the complete answer, but is a range of experiences and good practice from across the world. And I'd just like to thank UN Habitat and the World Urban Campaign for giving World Habitat the space to moderate and to share this discussion and invite people that we know are doing amazing things, as this is an open space for critical exchange between stakeholders from across the world. So just a brief introduction about World Habitat. Who are we and what do we do? So World Habitat is we're a global housing charity. that has been most well known for the World Habitat Awards, which we deliver in partnership with UN Habitat. This is a global housing competition that finds and shares some of the most innovative ideas in housing across the world. So this has been running since 1985 and has winners and finalists from over 85 countries across the world. Our modus operandum, our agenda is to find and transfer the knowledge and experience in innovation across the world in anything to do with the right to housing. One of our key other projects is the European End Street Homelessness Campaign, of which you're going to hear from in more detail today. This is a network of city campaigns across Europe, including Glasgow and Brussels, who you will hear from today as two of our presentations, and is focused around systemic improvements in data collection around urban homelessness and looking at the way that cities and organizations and NGOs respond to street homelessness by thinking about ways to develop and design better permanent housing solutions, such as Housing First, which I think we will certainly hear from today in some of the presentations. As with all other projects, COVID-19 has been had a seismic impact on the homelessness sector. So the campaign has worked really hard in recent times to share knowledge and good practice around how our cities in Europe have been responding to COVID-19. So we have lots of amazing resources on our website, and we'd really love for you to find out more. I think I've messed up the bit.ly link there, but that should be bit.ly/sign-up-homelessness, and you can join our mailing list to find out a little bit more information, or you can find out lots more on the World Habitat website. So I'm going to move on now to the panel presentations. I want to give space and time to the fantastic people that have agreed to join today. So without further ado, I'm really delighted that we could have worked closely with the Institute of Global Homelessness today. And I'm going to introduce now Julia Wagner, who is the Program Manager at the Institute of Global Homelessness. For those that don't know, the Institute of Global Homelessness was founded in 2014 and is a joint initiative of DePaul University and DePaul International. The Institute of Global Homelessness is the only organization leading a global movement to end homelessness. So I will now pass over the floor to Julia.
Thanks, Patrick, and thanks for this opportunity for IGH to participate in this webinar, and we're excited to share our work. I'm gonna share my screen, and then from the beginning. So my presentation will focus on the work of our Vanguard cities. IGH works in 13 cities across the world, including all 4 cities on this call, 2 we share with World Habitat. And then we also work in Sydney, Adelaide, Bengaluru, India, Santiago, Chile, Montevideo, and many other cities. And thanks for that introduction. And then also, for those that are not familiar with IGH, we align our work according to 3 strategic priorities. And in the perspective of COVID-19, the first is that we advocate for global homeless policy. So for COVID-19, we participated and led several calls, including we support the United Nations Working Group to End Homelessness. And then we also supported Brussels' global call for protection for people that are homeless. And then we also worked with cities and countries throughout the world to take concrete action to end homelessness. So during COVID-19, we developed resource guides based on past pandemics and developed a series of recommendations of best practices of steps to take. And then we also did extensive research about each country's response and shared that with our cities. And then we also shared it with our networks. And we also have worked to share responses. The chair of IGH's board is Dame Louise Casey, and she's the leader of the UK Rough Sleepers Task Force during COVID-19. And so it's been great to share the strategies with the UK and then also share different strategies of the Vanguard cities with her so that we have a global communication exchange. So specifically with the Vanguard cities during the COVID-19 pandemic, Vanguard cities have worked extensively to protect and house people that are experiencing homelessness. Homelessness is a public health crisis, and this has been severely worsened during the pandemic because they're, very vulnerable and medically at risk. So it's been extremely important to protect and house people that are homeless. So the work of the Vanguard cities has aligned under four main categories. The first one is assessment of data. So cities have worked to use by name lists that were already in place to understand who is homeless and monitor their progress throughout the system. Many cities have done additional research, including one of our cities, Bengaluru. They did a survey of migrant populations to understand their needs and current vulnerabilities. And then cities have also done an additional vulnerability assessment for housing prioritization. And then because many homeless people, they stay in shelters and congregate shelters are especially at risk, cities have increased their sanitation and quarantine procedures, and then also went to the streets to make sure that there's increased street outreach so people know the services that are available, provide resources and additional public health messaging. And then for the coordinated response, this has been increasingly important because of the need for multiple sectors, government, health, NGOs to coordinate to provide protection for people that are homeless. And this has meant increased communication. Many of our cities have done regular calls with all of their service providers, having webinars, having daily coordination calls, and then also used Google and Slack and different technology platforms to make sure that coordination is streamlined. And finally, housing for the homeless. So, during the shutdowns and pandemic, people living on the street, the line of protection during COVID is a home, and if you don't have that, so cities work to provide self-contained accommodation. So this is across the United Kingdom. They provided hotels in Australia, Montevideo, and many other cities, including the ones on this call. And so this was a great first line of defense. Because, this is an unprecedented challenge, different cities had various challenges during the pandemic. I sent out a survey to all of our Vanguard cities to better understand their needs and provide follow-up follow-up resources to their challenges. So the main challenge Vanguard cities experienced was availability of self-contained accommodation. So they weren't able to find isolation or hotels or hostels that people could quarantine or isolate during the pandemic. And then also there was just a vast increased need. So it was difficult to maintain staffing levels, quarantine facilities. There was a lack of supplies, and then also not enough testing available. And then some cities also experienced a lack of food and difficulty moving into settled housing. So looking ahead, I think the next step is to make sure that we don't go back to pre-COVID conditions. So there's steps in place to take that step, including developing strategies for expedited housing. So movement throughout the housing pathway that is streamlined so that it expedites it to housing. And then we've seen from several cities and several governments that they responded to the public health crisis for homelessness with expanded funding. So for the UK, the government has committed over 100 million. In Sydney, the government of New South Wales has dedicated 36 million. In Chicago, they've set aside money for over 1,000 homeless permanent housing for the homeless. And so it's been great to see that political response and, you know, working to hopefully reduce and then ultimately end homelessness in these cities. And then because affordable housing and permanent housing is a challenge in most cities, cities have developed different innovations to match that needs, including developing prefabricated housing and then also refurbishing different housing units, which are in Montevideo, they're managed by people that are living in them. So recommendations for the future and recommendations from what we've seen from the Vanguard cities. The first would be inclusive data. So collect disaggregated data where possible to better understand the needs and vulnerabilities of rough sleepers and have accurate data of who exactly is homeless and prioritize that based on need. And that goes into cohorts. So during COVID-19, the UK developed different cohorts to see who is the greatest at risk, including who had medical and disability needs that needed to have increased support. And then this also goes further into housing to, you know, prioritize who is most vulnerable and who is at greatest risk, and to develop cohorts to see who should receive prevention, who should receive rental assistance, and to use data to develop those strategies. And finally, collective impact. So make sure that the intersectoral response continues into the future, including expanded housing strategies to ensure that we don't go back to pre-COVID conditions. And we take this out as an opportunity to end homelessness and to use the strategies and the coordinated response to develop pathways of housing to move forward. So that is it. So finally, if you'd like to learn more about IGH and the work we do, you can go on IGH's website, ighomelessness.org, and you can also join our network, enroll in our newsletter, and we're having a new webinar series starting in September, and you can sign up on our website.
Thank you very much, Julia. That was a really great presentation to kick us off. I'm going to move on now to Susan McGee, who is the Chief Executive of the Homeward Trust in Canada, North America. The Homeward Trust Edmonton is a community-based not-for-profit organisation that uses a systems planning approach towards the goal of ending homelessness in Edmonton, providing resources, delivering programs, and relying on data to achieve the best outcomes for community members. So Susan, if you're ready, I will hand over to you now.
Thank you very much, and thank you everybody for including me in this conversation. It's always very exciting to learn what other communities are doing, and I also know that we've been fortunate in our community to not be as really hit hard as some centers are, and I'm both grateful for that, but grateful for all of those on the call and presenters that have been living in a harsher reality. But I think I'm sorry, I'm trying to figure out how to share my screen, and we did this all really well earlier. So okay. There, sorry about that. So just a little, really quickly about Homeward Trust. Do you see my presentation okay there? Great. We are a nonprofit, as was mentioned. In our country, we have organizations that manage funding, so we would be considered a funder to many, manage funding on behalf of government. We actually don't call ourselves a funder because our efforts to end homelessness is a pretty complex process, and we engage in multiple agency contracts in what we consider to be kind of a general contractor role. We have funding from all orders of government, provincial, federal, and provincial. Within the province, we have several other contracts, and then we allocate those to primarily housing first oriented and housing first intensive case management, as well as assertive case management teams, and more recently funding permanent supportive housing. Our community has enjoyed a lot of success, quite frankly, since we launched our first housing first team in And at that time, that year, our homeless count was about 3,100. And we had, prior to the pandemic, a reduction of almost 50% in our homelessness through the work of that program, and recognizing during that time that we had significant inflow into homelessness as well. We, though, since the pandemic, have seen an increase, and we have, some modeling that we'll talk about after that. But we've also continued to really focus on housing. So we do, as Julie mentioned, the by name list is now what we really emphasize in terms of real-time data and information, and this is currently where we're at in our community. We really kicked off in a mindset and with a lot of involvement of government, Homer Trust, Alberta Health Services. This is a health response, and I think that's one of the really important pressures that we've continued to discuss as a sector, is that everybody has a role, and as a health response, we've really needed to emphasize the responsibility of our health system throughout our planning efforts. Very early on, though, when we were looking at primarily what spaces we could stand up, because most of our agencies very quickly were required to close their operations in terms of day shelter. Overnight shelters remained open, but they adjusted quickly to some distancing requirements. Not the 2 meter, even now, not the 2 meter that's required in many centers, but to 1 meter actually even resulted in a loss of shelter space. And we also had all of our other public spaces and spaces that individuals without housing rely on throughout the day. And so day services are, I think, one of the areas that I would emphasize as being something that we've struggled with, because we don't have 24/7 shelters in our community. That's something hopefully that will change out of this experience. We did work very quickly to stand up one site that was intended to be a consolidation of other services, including shelters, but it ended up being a large day service center, as well as then some called the Expo. It's actually 500,000 square feet. It's a huge facility. The fact that the pandemic was, and we were in a state of emergency, resulted in it being closed down and being made available to us. So we were fortunate to have access to that. It is privately operated, so there was a lot of relationships associated. It wasn't a publicly owned and managed facility, so that was a lot to work through. But we did that very quickly. Within a week, we were up and running with kind of co-lead agencies on site providing services. Just kind of breaking into the shelter response, we are a winter city. We're one of the largest, I think we're the 5th largest city over 1 million and this far north. So just kind of thinking in terms of how we manage our cold and our temperature. We do have winter response plans, and so we're not unfamiliar with the need to seek overflow shelter, but this was a very different environment. And but we did have our provincial government funds the shelters here, and stood up a couple of alternative sites for meeting the kind of per cot requirements. However, they were in different parts of the community. So there was a need for transit, which again, the learnings of all of this too, is that we did a lot of things fast, and then we accommodated some less than desirable outcomes. And transportation between sites was one where we really, I think, failed to support a very clear intention of isolating in place and sheltering in place. We also opened Bridge Housing, which I'll talk about a little bit more later, just in terms of use, but it was a hotel that we were able to head lease. And I know many hotels, many communities engaged hotels very broadly. We were in our community, we were cautious about that. Certainly being having a hotel and then being stuck with a hotel that we needed to remediate and put, the expense of, we were concerned really about having to take responsibility for the hotel post-pandemic, and none of us knew how long this was going to last or what scale we were going to have to scale to. So that was one of the things that we were very cautious about, but we did for Bridge Housing, which is not a shelter. Everybody in the Bridge Housing has to be engaged with a housing worker, and it's very, very focused on transitioning people into permanent housing. So, sorry, this is a duplicate, I apologize. It's 120 units. The 2 other areas that we emphasized with many organizations that we don't currently have a contract relationship with was access to what we call supported referral relationships, in that they were able to access housing dollars. It was more in the prevention space. We do provide things like rent, damage deposits, some rental assistance. We have a social enterprise furniture store that provides housing to a couple of hundred previously homeless community members per month. So being able to access all of that really expanded our net in terms of prevention and being able to reduce some of the inflow into homelessness, and from our earlier modeling, we certainly did that. However, we still have that challenge in our community. Right now, we are kind of in a different space and have been required, because we are no longer in a state of emergency. The facility that I mentioned, the Expo Center, is going back to its previous intended purpose. And so we are shutting it down. We will be out of it in about 10 days. And we are in kind of a different regrouping around what we are doing, and taking not a lot of time, but different time in terms of our planning efforts and engagement. And so being able to also really reemphasize, and for my community, we can't do this enough, is that the unsheltered community members, we sometimes have about half of our homeless community members who don't access shelters, and in the pandemic we found that they were actually avoiding shelters even more than prior in all the research that we've done prior. So really making sure that our solutions acknowledge that, and also not relenting on our housing efforts. As I mentioned, we have a pretty robust housing first system, and we've continued to house. We actually co-located a number of agencies at the Expo Center to do housing. This is kind of gives you a little bit of an idea of just how we present our data, and this is just a snapshot of a number of dashboards. We did have during the day at Expo, 600 to I think the highest, just almost 800 people a day that were engaged in services throughout the day. So it was a great environment for us to have really assertive housing conversations. And during the pandemic, we actually housed more people during that time in our Housing First work than we did in the same period the year prior, because of our opportunity, I think, largely to engage. There was lots of other modifications that we needed to do around the program in terms of showing housing remotely by video, pictures. There was many of our housing workers actually worked from home during this period. So lots of accommodations around that, as well as that co-location at the isolation shelter and day services site really made a huge difference. Our shelter, we've been very fortunate that we have not gone over capacity. We are very much concerned, and I'll mention in a second what our modeling is for the future though, because being a northern city, we would see our winter capacity needs go up, as well as flu season, and going into a fall where we're going to be screening in a very, very different environment in terms of those facilities that serve community members. Just again, just in terms of modeling, we continue to see, and I think we'll continue to see, an inflow into homelessness. And this projects something quite gradual, and the reason that it's gradual is because we continue to house over 100 people a month. But the kind of policy things, and I don't want to get into a real policy wonk space, but there's been lots of really important policy decisions that have helped stem that inflow into homelessness that happened subsequent to us opening the Expo, and are now tapering off, or they will come to an end. Things like income benefits. We also had eviction mitigation strategies that were within our provincial government's mandate. That will cease September 1st. We fully expect to start seeing much more inflow from provisionally housed individuals and people who's have not been homeless at any point in their life and are not really familiar with the system. And we will be seeing that over the course of the next 6 months, and we see that quite. I'll skip over the shelter modeling. This is again just an example of how we model our shelter usage in real time. Our day services, we currently have a lot of work going to try to find a location, an alternative location to our Expo, but this is the tough part of where we're at in stage 2 of our relaunch, is that many of those facilities that were available to us previously are not. And so I just want to be really transparent about how challenging that particular situation is in our community, and the outcome of not resolving that, and what we foresee to be a lot of pressure on encampment growth and outreach, and being able to communicate on just an investment perspective, how much more expensive it is to do outreach with very large encampment populations compared to housing them. So lots of analysis going on. I guess if there was an important message out of us is that modeling space, we don't do plans anymore. We just, we're just talking about scenarios and modeling and trying to create a broad understanding of the potential consequences of the decisions that we may make. And that's a shift for sure in terms of how we've been impacted by how we need to communicate within the pandemic. And so it's not just a programmatic response, it's being able to engage a community very differently in what our solutions are. So our priorities right now continue to be a different kind of engagement. We've been having broad planning sessions with kind of weekly meetings with organizations. Bridge housing, the one that I mentioned earlier, currently has 98 people. We are also opening another bridge housing site October 1st. That was something in the works for about a year and a half, and the timing of it being approved by our city council has been really important. Now that just really makes a huge difference in facilitating housing outcomes for individuals who are living rough. So that's going to be very, very good for our community. And permanent supportive housing, I mean, the long game ultimately is to, we have a gap in terms of housing for people with really complex needs, and unfortunately that's a fairly significant number of people on our streets and in our river valley. So permanent supportive housing is being developed currently, and we have 4 sites that right now we are working with the city of Edmonton on finalizing plans for. I'm not going to get too much into permanent supportive housing. Many communities have it, but the difference for us from the, right now we have about 1,000 people on caseload in market housing that have the intensive case management team support, which is frequent but not on site. And we have found that our rehousing costs and the need for permanent supportive housing is really critical. And this environment is a time when we've been able to really emphasize that solution. And that's where we're at. I'm looking forward to questions. Thanks.
Thank you so much, Susan. That was really quite amazing to see what you can demonstrate in a very short space of time when you have a really comprehensive approach to data. That was really amazing. I love your quote. You said, we don't do plans anymore, we do scenarios and we do modeling. And I think there will be a lot of people who work in homelessness and housing that would love to be able to confidently say that. And have the data and the evidence over time to be able to kind of support asking for what you want based on what you know because of your grasp of data. So that was really amazing. Thank you. Next up, we've got Pierre Rigmans who is a coordinator from Infirmiers de Rue, which is street nurses in Brussels. Infirmiers de Rue is a non-profit organisation in Brussels doing reintegration of very vulnerable homeless persons through hygiene, medical care, skill valuing and housing. So I will hand over to Pierre right now.
Hello everyone, thank you. I have no PowerPoint for the presentation, but I have 4 main points, what I call opportunities to change, and I will underline them. And then I have 3 lessons learned. And I think if you have these 7 points, that's it. And the rest is more a story and how it happens a little bit in Brussels. And so it will be a different style of presentation. So what happened in Brussels, it started on 18th of March, we had a complete lockdown from one day to another. So it meant that all of a sudden we had one silent, empty desert city. All shops were closed, public services worked minimally. You were not allowed to be on the public space unless you had a good reason to do. You were supposed to work at home, schools and daycare were closed. So everything was closed, in fact. And how did our population react to that? How did they manage in that context? Well, we have 2 groups of followed population. We have people who are at home and people who are in the street. And of course, the image was very contrasted. So people at home, they were secure. They had food, or they could program to have it. They had water. They have access to toilet and hygiene. They were secure where they were. They even had entertainment with computer or TV or video game, and we could help them to get that. And most of them, their consumption get down because they were less tempted, because they were not allowed to go outside with the friends and be tempted. So this was in strong contrast with what happened on the street, where people suddenly were completely alone because there was no one else in the street. They had no information about what was going on. They didn't know what was happening. They had no money because they could not beg anymore. They had no access to toilets, no water, no food, because no money, and there were all the small snacks in cafes where they could get some help were closed. So they had to get money to go to a food shop to buy food. And there were very little possibilities to socialize because there were no people. So that's the first, I would say the first opportunity to change, the first scene I would stress is that suddenly we realized how vulnerable homeless people are in the streets and how secure it is to have a home. I think we have all lived that, we have all seen that. We knew it before, but now we really have seen that. And I think the general public have seen it also. So it's probably an opportunity to bring the change because everybody has realized that there is a big problem and of vulnerability. How did we as an organization adapt to the situation? Well, internally we had very strict rules of precautions. So whether it was with colleagues or with the patients, we always used these rules. So we didn't have the problem of having people forced to be in quarantine, because for us, only people tested positive go out for 2 weeks. The others, if they have symptoms, and if not, well, you are supposed to follow the rules and that protect you. And it appears to be very efficient as a way to work, and people felt secure and could continue to work. What did we do? Well, you can imagine in our big team who is responsible for follow-up in the home, they didn't have any work. I mean, they didn't have a lot of work because there were no appointment, administrative appointment or medical appointments. We said to the patients, we will come less frequently and the visit will be shorter. We continue to keep contact with the phone. So, but we had a big team and we were able to shift 5 people from this team to the street team. And they had, of course, much more work because they had to do, normally they do follow-up work for some patients. And now they had to do survival support for the whole population of homeless people in Brussels, because we were at a certain moment, we were nearly the only organization really working on the field. So the teams had to get food, clothes, water, even water, because people didn't have access. And then of course, prevention material, alcoholic gel, mask, and so on. But it was really the first time we had to get food to the people at this in this importance. It was a little bit frustrating for the team on the midterm, because they saw they were doing great job on the day-by-day basis, but they also saw that they were not able to help really people to do something else. I mean, we were just keeping things like it was and helping for survival. So this brings me to the second opportunity to change. We realized, so people are very vulnerable. And if you help people in the street, it's very difficult and it's a mess, because you have to bring all kinds of things: hygiene, clothes, food, water, prevention, medical care. And the street is not the ideal place to do that. How did the network in Brussels react to the situation? The night shelters closed in the sense that nobody get out and nobody get in, which is normal. But then for all the people who were outside these night shelters, there was a possibility. They opened the hotels, a lot of hotels. So at a certain moment, there were 800 places, 800 beds in these hotels. And this was a very good solution, and it went very fast with the help of the region Brussels. And we participated in the medical surveillance of one hotel, so 40 people. But because there were enough means and the tasks were divided in different people, it made all the sense, and it was really a good operation. And it's still going on for some hotels, not for all, but for some of them. And that brings me to the third opportunity to change. We have seen also that when needed, the means are found, and we have solutions. We can find solutions. And then when we have the means and the solutions, we coordinate, and then it allows everybody to work together, and it works really well. But you need to have the means to do that. What we also did, and we are still doing with the network, is the whole network of the city, is to lobby politicians to have this system of hotels be prolonged further, and to be able to continue until at least March for next year. So that we'll have prolongation until the winter, and then in the winter, of course, everybody will also stay inside, and then at least until March 2021. And we are also lobbying to have, of course, places to rehouse people. So we are working on places to rehouse, but we are asking the authorities to find these places also. So it's a very dynamic structure. What we also did was organize the testing for homeless people in the shelters. This testing was not foreseen by the region, and we forced a little bit the region to pay for it and to organize it. So this was a big success. As a fourth opportunity to change, I would say, I realized that we are caring for people wherever they are, in a home or in the street. But we should, of course, caring for them in a home because it's more efficient and it's much more easier. And we should see ending homelessness not as a goal in se, but as a byproduct of caring of the people, and as a symptom that you are really caring for the people. If you have homeless people in your city, you are not caring very well for your people. And if you end homelessness, it means that it's a quality symptom for your program. And maybe it could be a way to change the way we see and to change the system, and to focus on caring for people, and then seeing ending homelessness as just a byproduct of this action of caring for people. My 3 lessons learned is, one is more for the organization, that work at home and giving flexibility to the personnel is a very good thing. We will certainly continue to do that for our teams. Secondly, the patients are more autonomous than we think. We had surprises. Well, people in the homes, in their home, they did some administrative steps we didn't ask them to do, and they did it by themselves. So we were very surprised. And we think we should revise our way to work and maybe be less paternalistic sometimes. So it's interesting. And then thirdly, there is probably a way to improve dramatically the night shelters. If you take the hotels as a model, it means that you have privacy, because people have their own room, they have their own toilet, they have their own bathroom, which is considerable for intimacy. They have a day stay. This means they can stay in the hotel during the day. And in fact, during that period, they had to stay there because they couldn't go outside. But that was a good thing to get people more calm and ready to see their life in another way. So we should take an example of that. And then the third point is that in this hotel, there was follow-up by social assistants of the municipalities, which was also a very good point, and also a way for the municipalities to implicate in the rehousing of people, which was a very, very positive thing. That's it. Thank you.
Thank you very much, Pierre. That's a really interesting, your point about the autonomy of individuals and preventing us as homelessness organisations to be too paternalistic is a really prescient one. The research and evidence that we found through the European End Street Homelessness campaign is that some organisations were expecting there to be much more, particularly much more problems with people with multiple and complex needs. They were expecting there to be far more challenges with asking people to self-isolate, with checking people's health conditions, and actually their feedback, or when they reflected on how they were working, they realised that actually it was nowhere near what they were expecting, which is a really good lesson for everybody working in a homelessness organisation, to check yourself, to check your privilege, to check what attitudes you have towards how individuals will act. And therefore, as you pointed out, Pierre, how should we then change the way we work going forward to give people more respect, more autonomy, more choice, all things that we know are central to the concept of housing first, that if you give people choice and autonomy over where they want to live, they're more likely to keep that and stay in that accommodation, etc. So thank you for raising that as a really, really important point. I'm going to hand over now to Wayne Rankin, who's the project coordinator of the Tshwane Leadership Foundation in South Africa, which is another one of the vanguard cities under the Institute of Global Homelessness. The Tshwane Leadership Foundation is an inner city community organisation based in Tshwane. We are committed to a socially inclusive urban transformation and have demonstrated our commitment to the city's most vulnerable population since 1993, and created innovative programs for women and girls, children and youth and homeless communities. So I will now hand over to you, Wayne, which you will be unmuted, and Celeste, if you could start the presentation.
Yeah, thank you very much. Wayne Rankin from the Tshwane Leadership Foundation. We are based in the city of Tshwane, or what was known as Pretoria, in the north of South Africa. Next slide. So when the first infections of the coronavirus was detected in South Africa, the South African government had a swift and a hard response. A national state of disaster was declared on 15 March 2020 for 90 days, but it has since been extended until 15 August, and I suspect we might go beyond that. Our President Cyril Ramaphosa addressed the nation and announced that we will go into a hard lockdown from midnight 26 March. We all woke up to a very quiet South Africa on the morning of 27 March 2020. All our borders were closed except for the transport of goods. The internal provincial borders were closed, and it's still closed inside to travel inside the country except for work or schooling. An initial curfew was set up for 8 o'clock at night. It was lifted temporarily, and it's now been put back in for 9 o'clock every night, from 9 to 4 every night. No household visits to friends or family is allowed, and as they say, people might be too close, wear no masks or hug each other. From the hard lockdown, the initial hard lockdown, the government decided on a risk-adjusted strategy, which they have a phased lockdown approach to reopen the economy. Up to today, we are in 118 days of a total of lockdown. Next slide. The trust levels at the start of the pandemic and the lockdown in our government was relatively high. People, the whole of the country's spirits were quite in good. Our initial lockdown was going to be for 21 days. As they were saying, we need to flatten the curve and get our healthcare sector ready for the storm. But the longer the lockdown continues, we see more and increased police brutality. We see law enforcement abusing their power and law enforcement officials abusing people. We see people are becoming hungry, and we see the trust levels are dwindling in government. Our Health Minister, Dr. Mkhize, gives us daily updates on stats and information. He appears on a daily basis on TV, on social media, etc. Our President makes regular official announcements and writes an open letter to the country every week. We have a website and with stats and of resources. Our government has been utilizing WhatsApp for support line, or that people can can find information, or an emergency hotline where people can phone, as they are encouraging people not to go to hospital if you display any symptoms, rather phone the hotline or send a WhatsApp to the number that is provided. They've created field hospitals throughout the country with an increased bed space of over 27,800 additional beds that they estimate with what would be needed over and above what we already have. Next slide. One of the most controversial decisions the government has made was to place a ban on the selling and the transportation of alcohol and tobacco products, and they cited health reasons. Alcohol sales were opened up for a short period of time not long ago, and as good South Africans, we indulged, and hospitals became overwhelmed with alcohol-related incidents, and overnight, the ban on alcohol sales and transport were enforced again. The wearing of masks has become mandatory, and you face a prison sentence and even a criminal record if you do not comply. The negative side of all of this is that there's a report that surfaced, an estimate of 3 million people has lost their jobs in the last 3 months, which almost 2 million of them are women. But this, in a good sense, has sped up the conversation on issues like universal basic income. And we are estimating that we are entering into our peak, and for the next 2 to 3 months, we will be in our peak infection rate. Next slide. This is an example of a graphic that is shared every day on social media, on WhatsApp. This is the official statistics that is shared by national government on our infection rates, on the number of tests, on recoveries, total deaths, and on new cases for the last 24 hours. And you might not be able to see it now, but there's for each province the number of cases, recoveries, and so on. So part with the national disaster, that we declared a national disaster, a Disaster Management Act has been put in place, and that put a moratorium on evictions of people. Unfortunately, although there's a moratorium on evictions, we see it ongoing. We see government officials and our national government continue to acknowledge that people have been hard hit by the lockdown and that people might become homeless because of this. We've seen an acknowledgement of homelessness by our national government. Yet we continue to see evictions taking place all over the country. We see evictions taking place by a government unit called the Anti-Land Invasion Unit, where they go in, violently break down housing structures that are deemed illegal, that all people occupied the land illegally. We have seen in places like Cape Town, where an adult male was dragged out of his house while taking a bath. He was dragged out naked for all to see. Without dignity and any inch of humanity, he was pinned to the ground, naked, violently, while he watched his house being torn down. All of his things, all his belongings broken, destroyed. We have seen shack dwellers movements such as Al-Baghlali being plagued by law authorities, destroying their homes. We have seen our Minister of Human Settlements or our Minister of Housing continuously saying publicly and on social media that they're clamping down on illegal land occupation. And this is in a country that even before the pandemic, we faced a Gini coefficient index of 0.68, the highest inequality rate in the world. And this all is going on during a growing pandemic. Next slide. On March 24, 2020, our President Ramaphosa, announced the initial lockdown. And he announced that temporary shelters that meet the necessary hygiene standards will be identified for homeless people. We were all overwhelmed with joy. Unfortunately, there were no engagement with the homelessness sector. I am the secretary of the National Homeless Network. We lobbied, we engaged, we sought to engage national government about the practicality of this. No engagement was happened. It seemed to us that the responsibility for this to happen fell on the provincial and local governments to implement this action. Homelessness has never been a priority or even on the radar of our government. So there are no existing policies or frameworks to deal with this. This meant that the provincial and local governments were not prepared to implement the president's announcement. There are no national policies dealing with homelessness. There are no provincial policies. Only a few cities, including our own city, have policies on homelessness, and even few have dedicated budgets to address homelessness. This means that because of inaction for many years, we had a not so good place to start with at the beginning of lockdown. Very few cities had any form of homeless shelters before the lockdown. And now suddenly, a national lockdown, a hard national lockdown is enacted, a curfew is put in place, and homeless people have nowhere to go. Our organization, we are part of the local forum called the Tshwane Homelessness Forum, which is made up of various NGOs, FPOs, and so on, who work directly with homelessness. Despite the historical challenges that continue to plague our current situation, the last few months we've seen unprecedented collaboration and partnership to do amazing things. Next slide. In the city of Tshwane, we lobbied and we were able to set up an official task team, the Homelessness COVID Response Task Team in our cities, with members from government, from institutions of higher learning, and NGOs around. We collaborated with churches, NGOs, resident and neighborhood associations, and academic institutions. Overall, we had over 24 organizations and institutions that collaborated just in our cities, in our own city. We opened 25 shelters within a period of a few weeks. Over 1,500 to 2,000 people we were able to get into shelter in a matter of 4 to 6 weeks. Next slide. We had healthcare teams that were led by a family physician or internal medicine, with clinical associates, community health workers, nurses, and peer educators. The person leading the health response has said that yes, this is an unprecedented healthcare that homeless people have received in our city. 600 people were initiated an opioid substitute therapy with daily direct observational treatment. Over 100 new people initiated on antiretroviral drugs. We rolled out hepatitis treatment programs. We created individual plans for each person in the shelters. Social workers provided psychosocial services. A call center was set up where one NGO became our central NGO that placed people in all of our shelters. Daily reporting through SurveyMonkey and Google Sheets was used, and we continued to do outreach on the streets. Next slide. Three key learnings that came from this. One, collaboration and partnerships are painful, but they are essential. They must be built on common values, trust, transparency, commitment, solidarity between organizations and institutions. Secondly, holistic and integrated healthcare and psychosocial service is needed, not either or, not one or the other, but all at the same time continuously. Thirdly, the pandemic has shown us and highlighted that homelessness is an extreme expression of poverty, injustice, and inequality. It has placed an emphasis on homelessness as a crisis, meaning that homelessness did not become a crisis because of the pandemic, but that homelessness itself is a crisis. Next slide. Continued, and what we learned, the recommendations around the protection of right to housing, unfortunately that becomes very difficult as we do not have the funding and the structures for things like housing first and so on. But what we've seen is that we need continued advocacy and lobbying to ensure adequate government budget is allocated, political will is leveraged, and actions are sustained. Secondly, is having responsive litigation that supports people from being evicted. One of our partners is a human rights litigation organization, and they have been very active in litigation cases. Thirdly, continued education and awareness programs with the general society to conscientize people about street homelessness and to help understand and grapple with the complexity of homelessness. Just as a last thought, the author Jacobson wrote in an article in the Lancet to say, will COVID-19 generate global preparedness? And the author writes, the world does not need more evidence of health, social, economic, environmental, and other problems that arise when we fail to invest adequately in global health security. And this can be translated to homelessness as well. What is required is to break this panic, then forget cycle. It is to follow through on prioritizing, funding, and implementing preparedness and interventions. If I may take another minute, in what we've realized or where I find myself, is that throughout history we've seen a few times where global collective understanding and where we have a global collective language. We have seen in the past 20-30 years a global economic crisis and collapse. We have seen the events of 11 September in the United States, how it has changed global travel. We have seen how the moon landing, we've seen the fall of the Berlin Wall, we've seen the end of apartheid, we've seen world wars, we've seen what the cell phone and personal computer has done for us, the fact that we are on Zoom. We've seen the turn of the century when people feared Y2K. But now today we stand in such a time and a place. I'm a theologian, and in theology, we describe such a moment as kairos. It's where we stand now. Homelessness, and as Pierre mentioned as well, homelessness has been highlighted for all to see. The rise of individualism that we've seen, but the rise of individualism that has created just me, myself, and I. We've realized that the future for collective humanity requires for all to be safe, for all to be healthy. People have recognized that if people who are homeless are not cared for, their own health is at risk. I look back at the historical greats like Nelson Mandela, Beyers Naudé, Tutu, Martin Luther King, James Cone, Freire, Bonhoeffer, and I wonder, what would I have done in their time? Would I have participated in the fight for liberation? Would I have participated in the fight, in the struggle? But then the answer is staring me in the eye and saying, this time for me is now. It's for us, it's now. The kairos is here, and history will judge us on how we respond or do not respond. Thank you.
Thank you so much, Wayne. I have a feeling we should have put you last. That was a really amazing finish, and thank you so much for sharing so much of the history of what's happened in South Africa. I think I shamefully pronounced the name of your city completely incorrectly, so I'm sorry about that. Moving swiftly on, and our final presentation for this afternoon, I'm delighted to introduce Michelle Major, who is the change lead for Homeless Network Scotland, and is going to be joining us from Glasgow. Glasgow is a city that is both within the European Entry Homelessness Campaign and is a vanguard city with Institute of Global Homelessness, so we work very closely together with that city. And Homeless Network Scotland describes itself as an organisation that learns, connects and acts, putting knowledge into action alongside people who live and work with homelessness to help end it for good. So I will hand over to you now, Michelle.
Thanks for the introduction, Patrick, and we knew a very hard act to follow, so this might not be as inspirational. I apologise. I am also very conscious of the time and my quite strong Scottish accent, so I will do my best to speak slowly, but not so slow that I take up all the time. So yeah, my name is Michelle Major. I'm delighted to be here today, and my organisation is a network organisation across Scotland, but our home is in Glasgow, and that's very much what I'm going to focus on this morning. So just before I get into our national response, an idea of some of the figures in Glasgow at the moment. Our lockdown started on the 23rd of March, and since that time, from the 23rd of March up to the end of May, there have been roughly 100 homelessness applications each week. There have been around 4,000 people overall in temporary accommodation. Much of that is really high quality temporary furnished flats, but there's also roughly 1,000 people, in hotels and bed and breakfasts. No one has been moved into permanent housing during the shutdown, and our night shelters closed right at the beginning, and everybody who used the night shelters was then moved into the hotels. What is really positive though is that intelligence tells us that there is less than 5 people currently rough sleeping in Glasgow, which, if you know anything about Glasgow, is a really huge achievement. So how did we manage that? How did we get to that point? Glasgow's COVID-19 response was led by Glasgow's City Health and Social Care Partnership. So what one of the previous panellists said about health and social care integration being so important has really proven to be the case in Glasgow. So with that, we've seen high levels of collaboration, and homelessness was being treated with the urgency that it kind of always should be. People were making really quick decisions, making the right decisions, and we had funding from the Scottish Government to support people out of congregate spaces that weren't suitable for self-isolation and move them into hotels. And also really key to the success in getting people off of the street has been that we have been able to provide for people who have got no recourse to public funds due to their immigration status, which without that we wouldn't have achieved this success in moving people off the street. Having said that, homeless applications, as I said, have continued to be made. Around 75% of those are from single males who more than likely before the lockdown were in sort of insecure informal housing arrangements that aren't sustainable now that we're in a pandemic situation. Those who are in the hotels, which are based in Glasgow and Edinburgh, which is where we see a high level of rough sleeping in Scotland, there are 2 big cities. They are being supported on site by third sector organisations, the main one being Sound Community Scotland. And also very really exciting actually in our national response was that our housing minister has reconvened a task force from 2008, which is the Homelessness and Rough Sleeping Action Group. So when they met first in 2008, they developed a set of recommendations for how we transform our system into one that rapidly rehouses people, into one that is centred around housing first as being the first option that you try. And in 2008, all those recommendations were accepted, and that became Scotland's plan to end homelessness together. That group's been reconvened just to kind of sense check that plan in our current context, and reported back to the government a couple of weeks ago with about 100 recommendations, all of which have been accepted and will be really key in how we recover from the pandemic. And it also incorporated a lot of the objectives from a collaboration that I'll speak about later on in my presentation called the Everyone Home Collective, which is also going to be really key in how we recover going forward. So how did Homeless Network Scotland respond to all this? We do not provide any frontline services, but we do support members across the country who do all that crucial work. We were also aware at the start of the lockdown that information changed very quickly. It wasn't always easy to find, it wasn't always easy to understand. So it became our priority to collate as much as we could that was relevant to our membership and send out a weekly briefing about any news around COVID-19 and any developments, which has been really positively received and has made us think a wee bit more about the amount of that we're publishing, and maybe we should be doing that more in general. And the exciting bit for me is the formation of the Everyone Home Collective. So the Everyone Home Collective is 23 NGOs in Scotland, not all homelessness organisations, but the majority are, who have come together with the aim of creating a kind of shared framework for recovery from the crisis, and how we can lobby the government to ensure that all the good changes that have came around because of the pandemic are kept moving forward, and that we don't just revert back to what was normal before we kind of knew that all this was possible. Oh, how do I go back? Sorry. Challenges in learning. Keeping those in temporary accommodation from returning to rough sleeping has been a challenge. While people are in self-contained hotel rooms, that is by no means the ideal situation for anyone. That couldn't have been made clearer by a very tragic incident in one of the hotels in Glasgow, where there was a stabbing and consequently a fatal shooting. So that's really highlighted to everybody, I think, that while the hotels have been the right thing to do in the immediate term, long term, it's not a solution in Glasgow. Second challenge is going to be the recovery of the social housing system, because there has been no one moving into permanent housing. That, as I said, roughly 100 applications a week. That is a big backlog into social housing. And also we've had, we're very grateful to have it, but we've had emergency legislation that puts a stop to evictions, but does not put a stop to the accrual of rent arrears. So when that legislation eventually expires, which initially is meant to be September, but can be extended for 6 months and a further 6 months, when that comes to an end, there's going to be a long line of people with very high levels of rent arrears who are very likely to come into our system, which is something that we need to start planning for at the moment. And the key learning for me has been how urgently we can respond to homelessness and rough sleeping, and how, you know, when we have very specific IGH targets to reduce rough sleeping in the city centre, and when we've brought partners together in the past, it's been very difficult at times to get people to believe that this is possible. So what we really hope is that galvanising all that energy because of the pandemic should hopefully mean that, you know, we can keep that belief that we can do better than what we've already done. And just another couple of challenges will be the extension of a bit of legislation called the Unsuitable Accommodation Order, which by September will mean that it's prohibited to use any bed and breakfast type accommodation for any longer than 7 days for all households, which is a great change in the legislation and makes things a lot more equal amongst, you know, groups of people who are experiencing homelessness. But in the current situation is maybe going to be a challenge in its implementation. Wow, I've really whistled through this. I'm glad, because I'm really keen to keep the question time at the end. So we, as part of our work with the Everyone Home Collective, which I mentioned earlier, and I would really encourage you to look at the bottom there, it's www.everyonehome.scot, where you can see our full kind of plan and different route maps that are being published every couple of weeks, which are going to influence how we recover. So as that collective, we have got 3 key recommendations for how we build a better society and a better system as we recover. So the first one is to have more homes for good health, which is about prioritising prevention and creating more housing supply. The second one is about having no return to rough sleeping, so permanently prevent a return to previous levels of rough sleeping in all areas, not just in places where it's notoriously high. And lastly, no evictions into homelessness. We don't want to see people evicted into homelessness, and we don't want to see any more avoidable evictions, and we don't want to see people being threatened with illegal evictions anymore. So we really strongly believe that those 3 kind of core tenets of our plans going forward are what will help us build back better. That is really very much a whistle-stop tour, but please go on and find out more detail about those recommendations and the route maps if you're interested, because they're all on the website for you. And that's me. Thank you very much.
Thank you so much, Michelle. Just a quick reminder, you know, all of the information that you would have heard today, we're going to compile into a report with the links and any other further information that any of the panelists want to share, that we will share with the World Urban Campaign, will be available on their website. So thank you all so much for those fantastic presentations. I'm just going to move very briefly now. We've got about 3 or 4 minutes for questions. I didn't want to cut any of you short because there were such fantastic presentations, and at the end of the day, I want you to be able to share it, and that's the most important thing. So I will just quickly share my screen if it's possible. And I wonder if one of the key questions that has come out across our campaign and across many of the agencies that we work with is so much of the response to COVID-19 has been about those who they know are already or were already on the streets. But at the moment, there seems to be a bit of a gap around those who are going to be new to the streets. So if I might pass this question back to Susan, if that's okay, just for a brief answer to start with. What evidence is there for increasing numbers of people falling into housing inequality and homelessness due to the pandemic? So have you in Edmonton got any data or have any kind of grasp on the next wave of homelessness that is predicted, or how are you anticipating you could respond to this?
Mm-hmm. From a kind of significant baskets, one of the things that happened early on, and it'll be, we'll continue to monitor this, is that people who are precariously housed, or we would say provisionally housed in our count definitions and status definitions, maybe sharing homes with, there's really an underhoused group of people that are couch surfing. I know we all use kind of different vernaculars in our communities, in our countries, but individuals in those circumstances found themselves to be in an environment where self-isolating and sheltering in place. If you're precariously housed, you may have lost that housing and also not been welcome into another housing. We saw families actually have to break up because of isolating and had to, in some cases, were able to put individuals in hotels because somebody was symptomatic and was in an isolating situation. But the pressures on those individuals that are underhoused and couch surfing is one thing. Economically, obviously, this has been really, really hard for many, and for anybody who's had a significant change in their income, that population of community members who've never experienced homelessness before, that suddenly found themselves without any income. And I know that every place has had a different response to trying to mitigate that income impact, but some of the solutions have been relatively short term, and in some cases actually contributed to future instability, in that people received benefits that then they have put themselves into situations which may be even more tenuous in the upcoming couple of months. So the income space, and then just literally what is the pandemic, the impact on our ability to live alone and with others has been a significant contribution.
Thank you very much. If I might just pass very briefly the same question maybe to you, Julia, for a couple of minutes. If there's any experience from across the Vanguard cities that aren't represented today, or that would be really interesting.
I think, yes, in many of our communities, we're seeing that people that were previously not at risk of homelessness becoming homeless. In the United States, this is, we've seen increasing numbers, and then the evictions and the temporary assistance with unemployment is about to be expired. So we're watching kind of the government response, which has so far been not sufficient, and also seeing how prevention funds and expanded housing can have an impact. And in our communities, in Bengaluru, for example, because of the rising COVID numbers, migrants and people that are working but staying in homeless shelters, they're being encouraged not to work. So because of the risk, so that just increases, their instability and their kind of vulnerability in the future. In other communities, it's wintertime right now, so they're expanding their shelter, and they're trying to deal with increasing rising numbers. And then in Australia, because they've kept their COVID numbers down, they've kind of been able to mitigate that, but they are developing a prevention fund to kind of be able to support people that are at risk of homelessness.
Amazing, thank you so much. And I'm really sorry. We would love to have more time for discussion and questions, but I did say that we would finish on time, and that's kind of basically where we're at. So just to kind of to give some level of summation for today's session. First of all, I just want to say thank you so much to all of the people who have been presenting today. It's a real pleasure to be able to draw together the broadest range of speakers that I've ever and that we've ever had on a webinar, and we'd really love it if any of you want to connect with us and connect with any of the speakers, either through the attendees that have been joining you. If you want to hear more from the speakers and find out more information, just do get in touch or connect with us online. So we will be summarizing a lot of the key themes that we've looked at today, and I've just been kind of jotting down as we've been going, and these will be included in our report to UN Habitat. So there's been really strong themes around integrated healthcare, around not going back, around the sense that we have an opportunity now to really grasp and to move forward. But I really feel like that's a double-edged sword in the fact that we don't know what's coming in the future. What I'm really delighted to hear is some of the examples of the importance of data, which has been important in the past. It's important now, but it's important going forward in the future as we plan how we work together. And again, working together is the third point. Unprecedented collaboration and partnership, which was what Wayne talked about and others of you have talked about in your presentations. So, we know that we cannot succeed without the action and the funding of local and national government. So I'm delighted to hear that so many of you have been working closely, although it's not easy, but we can't respond to COVID-19 without effective partnerships. So, and I just want to finish on really on Pierre's point. Really, we need to really make sure that we understand the experience of those that are going through this COVID-19 pandemic, in terms of those who are street homeless or who have been housed, and I think their understanding and their viewpoint is central to challenge our own misconceptions as practitioners. So I will end with that here, and I just want to reiterate and say thank you again to all of you. Please keep an eye out online for the report or share the video that will be up, and we look forward to speaking to you all again soon. So thank you so much.